Accidents can happen anytime, at home, work, or anywhere. There you go, darling, all fixed up. We'll go and grab some ice cream shortly. Fortunately, the situation wasn't serious. But what if it were? Would I know what to do? Probably. As a concerned father who's taken the time to get properly trained, I feel good about being prepared in the event of an emergency and knowing basic first aid. In a real emergency situation, being prepared could save a life. This program will provide an easy-to-follow, step-by-step approach to recognizing an emergency and how to respond to it effectively. Let's take a look at some common injuries.
Bleeding. Bleeding is the escape of blood from the arteries, veins and capillaries. Internal bleeding occurs inside the body and may be difficult to detect. If bleeding is external, there will be a visible wound or break in the skin. Any break in the skin is susceptible to germs. Germs are microorganisms such as bacteria or viruses that can enter the body and cause infection.
Anyone who has spent any time in a kitchen has had to deal with minor cuts and burns. Severe burns and blood loss can be very serious. They can lead to shock and unconsciousness. But regardless of the severity, a wound or a burn requires immediate care to prevent infection.
What you should do: control the bleeding, prevent infection. Apply pressure to the wound with your fingers or palm. You can ask the casualty to do this while you put on disposable gloves. Have the casualty rest in a comfortable position. Elevate the injured area. For larger wounds, use a sterile wound dressing and a roller bandage to secure the dressing in place. Burns. A burn is a specific type of tissue injury caused by heat, chemicals, electricity, or radiation. The severity of a burn depends on the type of burn and on the size of the area of skin that is affected. What you should do: cool the burn, relieve pain and swelling, prevent infection. Raise the burned area and remove any constricting clothing or jewellery in case of swelling. Flood the burn with cold water for at least 10 minutes or longer if it's still painful. If no wound dressing is available, cover the burn with a clean plastic bag, tea towel or piece of kitchen film. Things to consider. Ice should not be applied to a burn. Don't break blisters. Never use any greasy ointments, lotions, creams or sprays. Don't remove anything sticking to a burned area. Don't touch burns with anything except sterile non-stick dressings.
Let's review. For cuts and grazes, elevate the area and apply pressure to control the bleeding. Use sterile wound dressing to prevent infection. For minor burns, cool the burn with water and elevate the area to relieve pain and swelling. Cover the burn to prevent infection.
Avoiding cross-infection. The potential for the transmission of viruses such as hepatitis B, hepatitis C, and HIV through contact of blood and other bodily fluids is a concern in any emergency. However, certain precautions can be taken to help reduce the risk. These include having and using protective equipment such as gloves and face shields, washing your hands thoroughly after treating a casualty, and having a first aid kit that's readily accessible and fully stocked. Dealing with unconsciousness. The body needs a constant supply of oxygen to allow vital organs to function properly. Oxygen intake is managed by the respiratory system, which is comprised of the airway and lungs. The body's circulatory system, which includes the heart and blood vessels, functions to transport oxygen to every cell in the body.
A person has collapsed. Stay calm. Use your eyes and all your senses. If you encounter a person who's collapsed, your immediate action can make the difference between life and death. If you follow these few simple principles, it'll help you deal with an unconscious casualty in a calm and efficient manner.
What you should do: deal with any danger, check the casualty's response, establish and maintain an open airway, check for breathing. If the casualty is breathing, place them into the recovery position.
First, you need to make sure the area is safe enough for you to approach and offer help.
Look for things around the scene that may threaten your own safety. If your own safety is threatened, stay back and allow properly equipped and trained professionals to handle any dangerous situations.
You now need to determine if the casualty is conscious or unconscious.
Check for responsiveness by gently shaking the casualty's shoulders and shout to see if the casualty responds. If the casualty does not respond, shout for help.
Confirm that the person has an open airway and that they're breathing. Let's take a look at how that's done.
Open the airway using the head tilt chin lift method. Tilt the head back with one hand placed on the forehead, while the index and middle fingers of the other hand lift and support the chin. Tilting the head back and lifting the chin will move the tongue away from the back of the throat and allow an open airway. Check for breathing by looking at the chest, listening and feeling for air for 10 seconds.
If the unconscious casualty is breathing, place them in the recovery position. The important thing is to keep the casualty off their back.
First, straighten the casualty's legs. Place the arm nearest to you at a right angle to the casualty's body, with the palm facing up. Bring the other arm across the chest and hold the hand, palm outward, against the casualty's face. With your other hand, grab the knee furthest from you and pull the leg up so that the foot is flat on the ground. Pull the leg towards you, rolling the casualty onto their side. Be sure to keep the casualty's hand pressed to their cheek to support the head. Position the casualty's leg so that both the hip and knee are bent at right angles. Monitor the airway and breathing until help arrives.
Let's review. For an unconscious casualty who is breathing, deal with any danger, check the casualty's response, establish and maintain an open airway, check for breathing. If the casualty is breathing, place them into the recovery position.
Cardiac arrest.
Cardiac arrest is when the heart stops beating. Along with airway and breathing, we also need to confirm that blood is circulating around the body. And together, this method of primary care is called the ABC of resuscitation, where A is for airway, B is for breathing, and C is for circulation. In the following section, we'll learn how to deal with cardiac arrest for both adults and for children.
Adult casualty, 8 years and older. Cardiovascular disease is the disease of the heart and blood vessels. It develops as materials build up in the coronary arteries, which supply oxygen-rich blood to the heart. Without enough oxygen, the heart ceases to function properly, which can result in a heart attack.
Yes, I know how important it is. You want these documents checked correctly, and that takes time. I can only do so much on my own. No, I can't work late. It's my wedding anniversary. If I don't go home, I'd better be dead.
Johnny, you all right?
Check for responsiveness by gently shaking the casualty's shoulders and shout to see if the casualty responds. Immediately open the airway and check for breathing. If the casualty is not breathing, send a bystander, if available, to call an ambulance.
Yes, please, ambulance.
Give the casualty 2 effective rescue breaths. When giving rescue breaths, pinch the casualty's nose shut. Place your mouth around the person's mouth with a tight seal. Blow firmly and steadily into the mouth for about 2 seconds. Look at the chest to make sure your breaths are going in. Each breath should make the chest rise. Make sure the head is back far enough to ensure an open airway. Make sure the nose is closed so that the air can go directly into the lungs. Check for signs of circulation by looking for breathing, movement and coughing. Check for circulation for no more than 10 seconds.
If the casualty shows no signs of circulation, begin cardiopulmonary resuscitation, more commonly known as CPR.
CPR involves the combination of chest compressions and rescue breaths to simulate blood circulation and breathing. To find the hand position on the chest, place 2 fingers at the point where the lowermost rib meets the breastbone. Plant the heel of your other hand on the breastbone next to the 2 fingers. Cover the hand on the breastbone with your other hand and lock your fingers. The fingers of the hand underneath should be lifted off the casualty's chest. Give 15 compressions, 4 to 5 centimetres or 1.5 to 2 inches deep. Keep your shoulders directly over the breastbone, making sure your arms are straight up and down. Keep your elbows locked. Following the 15 compressions, tilt the head back and give 2 rescue breaths to oxygenate the blood. Continue cycles of 15 compressions and 2 rescue breaths until medical personnel arrive and take over.
Let's review. For an unconscious adult who is not breathing and has no signs of circulation, check the casualty's response, if it is safe enough to do so. Open the airway and check breathing. If the casualty is not breathing, call emergency services. Give 2 rescue breaths and check signs of circulation. If there are no signs of circulation, begin CPR by giving cycles of 15 compressions and 2 breaths.
Child casualty, 1 to 7 years old.
The best way to deal with an accident is to prevent it from happening in the first place. But sometimes children's natural curiosity can lead them into trouble. In the home, contact with faulty switches and appliances can cause burns and even cardiac arrest. Whatever the cause, responding to cardiac arrest in children uses the same principles as for adults, but there are some key differences. So let's take a look at them now.
Danny, what's happened?
Once you're confident that the area is safe, check for responsiveness by gently tapping the casualty's shoulders and shout to see if the casualty responds.
Can you hear me?
Never shake a child to determine level of consciousness. If the casualty does not respond, shout for help.
Amy, help! Quick! Quick!
Just as with the adult casualty, immediately open the airway and check for breathing. Open the airway using the head tilt chin lift method. Check for breathing by looking at the chest, listening and feeling for air for 10 seconds. If the casualty is not breathing, send a bystander if available to call an ambulance. Give the casualty 2 effective rescue breaths. Check signs of circulation. If the child shows no signs of circulation, begin CPR. To find the hand position on the chest, place 2 fingers at the point where the lowermost rib meets the breastbone. Plant the heel of your other hand on the breastbone next to the 2 fingers. Give 5 compressions, each being 1/3 of the depth of the child's chest. Lean over the child, keeping your arms straight. Keep the fingers lifted off the ribs. After giving the 5 compressions, tilt the head back, lift the chin and give 1 rescue breath. Give 5 compressions and 1 rescue breath at a rate of 100 compressions per minute. Continue the cycle until medical personnel arrive and take over.
Let's review. For an unconscious child who is not breathing and has no signs of circulation, check the casualty's response, if it is safe enough to do so. Open the airway and check breathing. If the casualty is not breathing, call emergency services. Give 2 rescue breaths and check signs of circulation. If there are no signs of circulation, begin CPR by giving cycles of 5 compressions and 1 breath.
Infant casualty under 1 year old.
In Britain, drowning is the 3rd most common cause of accidental deaths amongst children, after road accidents and burns. An infant can drown in an inch of water, so they must always be constantly supervised. We treat infants in a similar way to older children, but there are some differences. So let's take a look at them now.
Check for responsiveness by tapping the infant's foot. Never shake an infant to determine level of consciousness. If the infant does not respond, shout for help. Open the airway by gently tilting the infant's head back. Use 1 finger only to lift the chin. Check for breathing by looking at the chest, listening and feeling for air for 10 seconds. If the infant is not breathing, send a bystander if available to call an ambulance. Give the infant 2 effective rescue breaths. Place your mouth around the infant's mouth and nose with a tight seal. Check signs of circulation. If the infant shows no signs of circulation, begin CPR. Place the tips of 2 fingers, 1 finger width, beneath the nipple line. Give 5 compressions, each being 1/3 of the depth of the infant's chest. Give 1 rescue breath through the mouth and nose. Give 5 compressions and 1 rescue breath at a rate of 100 compressions per minute. Continue the cycle until medical personnel arrive and take over.
Let's review. For an unconscious infant who is not breathing and has no signs of circulation, check the casualty's response if it is safe enough to do so. Open the airway and check breathing. If the casualty is not breathing, call emergency services. Give 2 rescue breaths and check signs of circulation. If there are no signs of circulation, begin CPR by giving cycles of 5 compressions and 1 breath.
Choking. Choking can occur when a foreign object blocks the airway. The airway is the passage through which air moves from the nose and mouth through the windpipe and into the lungs.
A blockage in the airway can occur accidentally while eating. For children and infants, it's often caused by them putting a foreign body in their mouth.
Adult casualty, 8 years and older.
An adult can usually indicate when they're choking. Signs include difficulty breathing or speaking, coughing, or clutching at the throat.
What you should do: clear the obstruction from the throat. Perform CPR if the casualty becomes unconscious. Get the casualty to hospital if necessary. If the person is coughing, encourage him to continue.
Tim, cough for me.
If the person's barely able to breathe and coughing becomes very weak, stand behind the person and deliver up to 5 sharp back slaps in between the shoulder blades with the flat of your hand. If the back slaps fail to dislodge the object, prepare to give abdominal thrusts. Abdominal thrusts simulate the action of coughing. Air that is trapped in the lungs is forced out to push the object out of the airway. Stand behind the person and wrap your arms around their abdomen. Make a fist with one hand. Place the thumb side of the fist above the navel and below the rib cage. Grab the fist with the other hand and pull inwards and upwards up to 5 times. Give 5 back slaps and 5 abdominal thrusts for 3 cycles. If the casualty is still choking, call an ambulance. Continue to alternate back slaps and abdominal thrusts until help arrives.
A completely blocked airway hinders the person's ability to breathe. So be prepared to perform CPR if the person loses consciousness.
Immediately open the airway and check for breathing. Attempt to give the casualty 2 effective rescue breaths. If you are unable to give 2 effective rescue breaths after 5 attempts, immediately commence chest compressions to try and dislodge the object. Give 15 compressions, 4 to 5 centimetres or 1.5 to 2 inches deep. Following the 15 compressions, check the mouth for the obstruction. If you cannot see the obstruction, tilt the head back and give 2 rescue breaths. Continue cycles of 15 compressions and 2 rescue breaths, checking the mouth after each set of compressions until medical personnel arrive and take over, or the object is coughed up and the person begins to breathe.
Let's review. For an adult who is choking, deliver alternating series of back slaps and abdominal thrusts to clear the obstruction from the throat. If the casualty becomes unconscious, perform CPR by giving cycles of 15 compressions and 2 breaths, checking the mouth after each set of compressions.
Child casualty, 1 to 7 years old.
Infants and younger children are particularly at risk from choking. So younger children should always be given appropriate soft foods in small pieces and should always be supervised when eating.
Here's a toast, sweetie. Do you want another piece of toast, Johnny?
When a child is choking, the aim is to dislodge the object as quickly as possible.
Okay.
If the child is
Just
coughing,
keep coughing,
encourage
keep
him
coughing.
to
That's a good boy.
continue.
Just keep coughing.
If coughing becomes very weak, deliver up to 5 sharp back slaps in between the shoulder blades. If the back slaps fail to dislodge the object, stand or kneel behind the child. Give chest thrusts by holding a fist against the lower part of the breastbone and pressing inwards up to 5 times. If chest thrusts fail, hold a fist against the abdomen, above the navel and below the rib cage. Give up to 5 abdominal thrusts, pulling inwards and upwards. Repeat the series of 5 back slaps, chest thrusts and abdominal thrusts for 3 cycles. If the child is still choking, call an ambulance. Continue to alternate back slaps, chest thrusts and abdominal thrusts until help arrives.
Be prepared to perform CPR if the child loses consciousness.
Open the airway using the head tilt chin lift method. Check for breathing by looking at the chest, listening and feeling for air for 10 seconds. If the child is not breathing, attempt to give 2 effective rescue breaths. If you're unable to give 2 effective rescue breaths after 5 attempts, immediately commence chest compressions to try and dislodge the object. Give 5 compressions, each being 1/3 of the depth of a child's chest. Check the mouth for the obstruction. Give 1 rescue breath. Give 5 compressions and 1 rescue breath at a rate of 100 compressions per minute. Continue the cycles of 5 compressions and 1 rescue breath, checking the mouth after each set of compressions, until medical personnel arrive and take over, or the object is coughed up and the child begins to breathe.
Let's review. For a child who is choking, deliver alternating series of back slaps, chest thrusts and abdominal thrusts to clear the obstruction from the throat. If the casualty becomes unconscious, perform CPR by giving cycles of 5 compressions and 1 breath, checking the mouth after each set of compressions.
Infant casualty under 1 year old.
Infants love to put things in their mouth, other than food. So parents and other supervisors must keep a constant check on the environment and all toys to make sure there are no small pieces lying about.
Lay the infant face down on your forearm with their head lower than their body. Make sure the infant's head and neck are supported. Give up to 5 sharp slaps in between the shoulder blades with the palm of your hand. Watch to see if the object is dislodged. If this does not work, lay the infant face up on your forearm and use 2 fingers to give up to 5 chest thrusts. If the object has still not cleared after 3 cycles of back slaps and chest thrusts, keep the infant with you and call an ambulance. Continue to alternate back slaps and chest thrusts until help arrives.
A completely blocked airway hinders the infant's ability to breathe, and the infant may lose consciousness. So be prepared to perform CPR.
Immediately open the airway and check for breathing by looking at the chest, listening and feeling for air for 10 seconds. If the infant is not breathing, attempt to give 2 effective rescue breaths. If you're unable to give 2 effective rescue breaths after 5 attempts, immediately commence chest compressions. Give 5 compressions. Check the mouth for the obstruction. Give 1 rescue breath through the mouth and nose. Give 5 compressions and 1 rescue breath at a rate of 100 compressions per minute. Continue the cycles of 5 compressions and 1 rescue breath, checking the mouth after each set of compressions until medical personnel arrive and take over, or the object is coughed up and the infant begins to breathe.
Let's review. For an infant who is choking, deliver series of alternating back slaps and chest thrusts to clear the obstruction from the throat. If the casualty becomes unconscious, perform CPR by giving cycles of 5 compressions and 1 breath, checking the mouth after each set of compressions.
You've just learned that whether it's a small cut or a cardiac arrest, providing first aid requires action. And as someone who wants to make a difference in a life or death situation, your next action is to get properly trained and certified by your local Red Cross. Hello, darling. Take the action that may someday make a difference to someone in need. Be prepared to save a life. Come on, let's go get that ice cream.